Hello, everybody. My name's Steve from Action Kidney Cancer. Thanks for joining us today. I'm joined again by Chris Jackson, person-centered counsellor. We recently did a video around thoughts and feelings and counselling and the benefits of for people who've been diagnosed with kidney cancer or any form of cancer. And today we want to move the conversation along a little bit further to talk about beyond sort of treatment and once treatment started. So firstly, thanks for joining us again, Chris.
You're welcome.
So we finished off last time by sort of talking about if people's thoughts and feelings and ways of managing these things changed once the treatment plan had been put in place. And I think your sort of thoughts and processes were that's entirely individual. So what I want to move along to today is there any common traits you notice as a counsellor when you're working with patients who are actually going through treatment? Is there any common worries or thought processes that people go through?
I think the first thing I want to kind of say, the first thing that kind of came into my head thinking about this is the sheer determination to get through the treatment, and the bravery that sits behind that. I think that is something that does need to be recognised because it is such a grueling process to go through. Yet that determination and bravery shines through often when I'm sitting with patients. Of course, with that comes fear of the unknown, fear of what could be, where it will take them. So it's a very unsettling time, isn't it, for patients going through treatment plans, how they're going to feel. A lot of people experience severe exhaustion, and that's difficult to sit with and deal with. So I would say impatience as well, maybe sort of an impatience and a frustration to get to the end. It's a good thing. It's not a bad thing. It's just I want to get to the end and I want to be okay. I want to know the treatment's worked. I want to get on with my life. I just want to be normal again. I think that's generally what comes through for me.
Just picking up on one thing you said there, do you find that patients see themselves as brave, or is that just what you see comes through? Because I think experience that I see or we see as a charity is people don't necessarily recognise it as brave. They see it as something they have to do.
Yeah, I would totally agree with that. I am inspired every single day when I sit with patients at the way that they deal with the situation. I think you're right. They don't see it. They're scared. They're fearful. Of course they are. But their outward persona is, for me, brave. They're brave and they're determined.
Yeah. And do you think that's sort of helpful to help them understand that that is something brave, or do you think it's just something better left unsaid?
Yeah, I would never sort of sit with them and say, "Oh, you're brave," because that would undermine their feelings and how. I think that was just my noticing that when I sit with patients, that's how I'm inspired by patients.
Yeah, great. So one of the processes that all cancer patients have to go through is when they're on treatment processes, or even when there's no evidence of disease really, is regular scans. Now they can be anything from annually, 5 years, down to 6 months, 3 months, or even shorter than that, depending on trials and treatments. How do you find patients cope with that scanning process?
Yeah, it's commonly known as scanxiety, and something that we recognise in every patient. And why wouldn't you? It's that fear of the unknown, isn't it? Our minds go into that future thinking, that forward place of what if this, what if that, what if the other, and it can get carried away quite a lot as well. And so that is something that we recognise when we're working with clients who are going for scans, whether that be during treatment, after treatment. It continues all the way through, doesn't it? Even once treatment's finished, you have to go on for regular scans. I don't think that scanxiety ever goes away. That's not something that I've noticed. It may get easier, but I don't think it ever goes away. And I think one of the things that we do in counselling with that is to try and ground people and to bring them back into the present moment, because when our head goes into the future, it creates anxiety. So by trying to sit with them and bring them back into the present moment, what evidence have they got to back up those thought processes? I'd kind of work with them in that way to ground them.
It sounds like almost getting them to concentrate on what they can control at that particular time.
Absolutely. Yeah, absolutely.
They can control what's going on in their life right now. Ultimately, they can't have a control, can they, of what the scan says, but they can with whatever the results are ultimately from that.
And they can also control how they go into the process. They can control what they think about and how they prepare themselves. That is one thing they can control.
Yeah, really good advice. So, in general, how do you think counselling can help patients or carers struggling with treatment and taking control of their situation?
For me, it's about offering that safe space where a patient or carer can say exactly how they're feeling. You know, quite often working with patients and carers who are going through that process, it's normal to worry, what if this is a bad ending? They have no evidence of that potentially, but it's natural to go to that place, that fear. And so having that counselling space gives you that opportunity to say what you feel, say what your fear is, without the fear of upsetting others.
Mhm.
So they can just sit and be open and honest, and we can work with that then, and we can then rationalise it, bring it back to the moment, start to look at how we normalise what's going on for them, and working on maybe some acceptance of the process that they're going through. And then through that process, we're sort of working towards a new normal, because when anybody's gone through any kind of cancer, there is a new normal process that we have to try and find at the end of it, because it changes your whole life, doesn't it? It's almost like your life jigsaw gets chucked up in the air and lands, and we've got to rebuild it in that counselling space.
Absolutely. And often we find with talking to patients and through the charity that it's not necessarily always just the cancer, it's the things that go on around life, really, as well as the cancer diagnosis and treatment itself.
Yeah, because I mean the treatment itself can be grueling for some people and not for others, depending on what type of treatment you have, how long you have it for, the strength of it. So everybody experiences something slightly different. And unfortunately, you know, you do get other people chipping in from the outside that may have a different opinion of what you may be going through based on what they've experienced or what others may have experienced, or their assumption as well, their assumption of what it should be. And I think one of the things that I struggle with when I'm sat with clients is when I hear things like, "Oh, so and so says I should just get on with it now. You know, I've been through my treatment and I should just get on with it." And it's kind of like, wow, that's a massive process. It's just starting. You've gone through your treatment, you've got through it. I think the process to your new normal is just starting at that point.
Mm.
Yeah, many people think, "Oh, you're lucky. You're lucky. You've had treatment and you survived."
Yeah, absolutely. So, just summing up, really, over the two videos, we've spoken a lot about the benefits of counselling and having that independent space to speak. And like you just said, especially when you talk to friends and family, you often get an opinion back, don't you? So it's difficult to expressly say what you want to say. As part of the charity, we run a patient forum where it is purely for other patients and other carers. As a counsellor, do you see the benefits of actually talking to other patients?
Absolutely. One of the things that the word that's popping into my head now is isolation. I think when you're going through a cancer journey, whether you like that expression or not, I think I mentioned that last time, there is an isolation. You feel isolated. There's just you going through it. So to be able to tap into something like the patient forum on your charity is fantastic, because it takes away that isolation. You're in it with others. You have a place. You don't feel so alone in the process. And you can share experiences, share stories, get advice, take it, don't take it. It doesn't really matter, does it? It's just that place where you can sort of be in it with somebody else. I think it's really important.
Absolutely. I think that's a great message to take away, the importance, and both can work in tandem with each other, having that somewhere completely separate in counselling and somewhere where you can talk to people who ultimately get it.
Absolutely. Yeah. There's always different avenues to take, isn't it? It's not a one size fits all ever.
Mm,
Get your support, utilize your support networks wherever that is appropriate for you.
absolutely. Okay, great. Well, thanks very much again, Chris, for your time. It's been really appreciated, the two
You're welcome.
videos you've done with us, and hope everything carries on going well in your line of work. And thank you very much on behalf of the charity.
You're very welcome. Thanks for having me.